My name is Dr. David Weinstein. My partner in the back is Dr. Ronald Sinagra. We formed the Sunrise Wellness Center 5 years ago. What we want to try to accomplish today, I put myself in your shoes. If I was sitting in the audience, what I would want to learn today is what can I do to get help from the condition that we came here for. What we want to show you today is a practical, functional, natural approach to dealing with health conditions such as autoimmune conditions, fibromyalgia, thyroid-related, chronic fatigue, diabetes, adrenal problems, so forth and so on. We're going to try and show you a step-to-step program that we do in our office that's helping folks. Now, one of the things we notice is that when people come to our office, they have their diagnosis and they kind of wear it like a coat, kind of like you're stuck with this thing and you have to live with it. Maybe you treat it medically, maybe you treat it some other way. But a lot of times we feel that patients don't always know that they can be healthy, and we want to try and disprove that tonight. Now, Dr. Sinagra and I met 27 years ago in chiropractic college. We've each been practicing over 25 years. In the last 5 years, we spent hundreds of hours learning how to deal with what's called foundational healing, how to get to the cause, the root cause of problems, and help people get well. What I want to do right now is bring one of our patients forward who was kind enough to come today, because I kind of feel like when patients come to the office, we tell them what we do, and they're still not so sure that they can be well. And I want to bring up someone who's been with us for a couple of months now, who's had a nice experience in the office, and have her share with you, so at least maybe seeing that you can say, boy, if it helped her, maybe it can help me. Go on. Do you want to just watch yourself?
Yeah. Hi. Okay, I'm not a paid sponsor here. I just, they asked me to come and speak to you, and I'm just a regular patient. But I just wrote, I'm not going to read off of this, but I have some key words that I wrote down. I'm just going to throw out some diagnoses. Lupus, Hashimoto's disease, asthma, Raynaud's disease, chronic fatigue, Epstein-Barr, fibromyalgia, obesity, hypertension, hyperglycemia. Those are all the labels, plus I'm sure there was more that I walked in with. And I did the best I could for a really long time. These guys have been practicing for 27 years or 25 years in practice, and I've been sick for 20. So I kind of did my own thing and saw different practitioners. I have lots of different physicians that work with me. And I got to a certain point where I was surviving the day. So surviving the day was enough to get up, do what I needed to do, go to work, and then make it through the day, and then go home and collapse. So it wasn't a very happy place, but I was.
We've been there. We have.
I didn't expect to cry. I'm sorry. No. So some of the symptoms I had were headaches, fatigue, dizziness, chronic weight gain, joint pain, muscle weakness, lethargy, and lots of anxiety. And I think the anxiety had to do with my health being completely out of control and my life being out of control. And I thought I was just anxious, like an anxious person. And that's one of the things that went away, and that was a huge surprise for me. I heard a radio commercial, and I'm familiar with chiropractic. I've been to chiropractors, and I heard the radio commercial, and they introduced that they work with autoimmune disorders, and I said, maybe these guys can, help me. Then I went onto their website, I looked at the testimonies, and I saw this one particular woman that really struck me, and I said, maybe they really can help me. And then I walked in, and they dazzled me with all these big words, and I knew that they knew what they were talking about, but I didn't get it till I did it. And it's only been 3 months, and my little presentation thing here went away. But I have to tell you that these are some of my improvements. And I had to write them down because I was talking with Dr. Dave like last week, and he was going down my symptom list, and I was laughing because I didn't even remember that these were my symptoms. So I don't have headaches anymore. I'm not dizzy anymore. I lost 30 pounds in 3 months, and it hasn't even been that hard. I feel kind of guilty about it. Less fatigued, I have a lot more energy. Less pain, less aches, my fingers, my ankle. I used to limp a lot, so it was kind of embarrassing, but I don't have that anymore. In fact, I was hiking this morning. More energy, a lot less anxious, and my asthma is so much better. This is my worst time. Sometimes I'm in and out of the hospital, and I forget to take my medicine. So I am really grateful. They know that I'm really grateful. I think that's one of the reasons they asked me to come in, because they knew that I really appreciate everything that they do. And the main thing for me is that I'm no longer surviving every day, but I actually am living. So sometime within the first few weeks, all of a sudden there was hope. I felt hopeful that I could actually plan for a future, where I was just planning the next day, can I make it through the day, and when am I going to be on disability? I don't think I can anymore. So I just wanted to share that with you. If you guys don't feel well, there's no need to not feel well. You can feel better. So that's all I wanted to share.
Thank you.
So what we're going to do now is kind of go through what we told Dawn in the beginning when she came to the office, and walk you through how we would, observe you folks in an effort to try and help you. So I'm going to bring Dr. Sinagra up, and he has some lab slides that he's going to go through as he, walks you through this thing. Okay, folks?
I am trapped in the 80s, so I still use an overhead projector. I hate technology, and technology hates me. I still can't turn the phone off when it starts ringing, and I don't know how to do that. So I'm Italian. I also need a pen in my hand at all times. Keep that light on, David, please, for right now. You see the smiley face? Well, the anti-smiley face? That's our patients when they come to see us. And when they come to see us, they come to us because they bought a falsehood. They believed that once they were told that they have a chronic autoimmune condition, that all they could do was treat and live that way. And that's nothing could be further from the truth. What we have to understand is that medicine, as beautiful as it is crisis care. Medicine stops us from dying. It's a fireman, it puts the fire out. But medicine cannot get us healthy. Do we have we have a driver's report? Yeah, good. If you looked up health in the textbooks, it's 100% function of your body. Now, nobody may be 100%, but darn close. So, is it safe to say that your body function has to drop down to 80% for you to start to have a health problem? If you're walking down the street at 100% function, you're healthy. You can't be sick and healthy at the same time. So your body starts to malfunction, and I'm picking 80%. And that marker stinks. Try this one. Okay, there we go. All right, and now you get a symptom or you get a disease. And we start to treat with the steroids and the anti-inflammatories and the painkillers and everything else. What's your real problem? Your real problem is this. You're not working right. You have to restore function. Our bodies malfunction, we get a symptom, and we stay at this level, and we treat the symptom or the malfunction. But what are you doing to bring your body function back up? It's not even addressed. It's not even addressed. So that's what we're going to do. We're going to go through, and I'm going to make sure that you understand how we look at it. I got my notes here too. I'm pretty good. We use a two-pronged approach to healing. We have a neurologic approach and a metabolic. I'm going to start with the metabolic. This is all of your metabolic systems, primarily. There's a couple, I don't have the cardiovascular system up here, and a few others, but start here. Immune system, adrenal glands, cortisol, food allergies, liver, thyroid, gut, kidneys, blood anemia, blood sugars, and sex hormones. If all of those systems are functioning properly, that's a smiley face. You see, this is what we've noticed. When people come in with chronic illness, inflammatory conditions, and autoimmune conditions, you never have one system that's broken down. You have multiple systems that break down. And this is why medicine fails us so poorly. You walk into a medical building, you go up, and you go to the directory, and you pick your doctor by your body part. Right? If you got a food, actually, if you got thyroid problem, you're going to go to the endocrinologist. If you got a gut problem, you're going to go to the gastro. If you have a female problem, you're going to the gyno. But they never communicate. But the definition of health is 100% function or synergy of all these systems. Well, how can that get us well if we don't even communicate? We don't. Medicine takes these systems out and they treat them, and it doesn't work that way. Let me give you some examples. And I'm going to be fast today because I know that from college, we only got about 30 minutes of brain power before we just go blah and melt. So I'm going to remember that. Of all the systems that we're working with, when we look at the body, you must understand blood sugar is one of the most important. So when you have high blood sugar, you instantly engage the adrenal glands because blood sugar and pancreas are on one side to lower your blood sugar. You eat sugar, your blood sugar goes up, your pancreas releases insulin, it goes down. What raises it back up? The adrenal glands and cortisol. Since World War II, and since we've commercialized the food industry, see, prior to World War II, there was no such thing as fast food or processed food. There was food. That's it. We eat massive amounts of carbohydrates. Our body was never designed to eat. Never. Think about that. Most of what we eat is carbohydrates. So we start to have this problem where we're engaging the adrenal glands and the sugar, and we start this pendulum thing. Once, this is backwards compared to what I'm used to doing on my desk. I'm looking at this the wrong way. So your blood sugar goes up, you engage the adrenal glands. The adrenal glands release cortisol. It's also our stress hormone. Cortisol is like passing gear in your car. It revs everything up. And it's great. It's meant for stress, crisis situations, and to balance out our blood sugar. Once you have too much cortisol, you immediately affect the thyroid. The thyroid makes T4. The body must convert T4 to T3. Cortisol blocks that. It blocks the conversion. So, from blood sugar to adrenals to thyroid to gut damage. Once your gut starts to leak, it releases something called inflammatory cytokines. It starts the inflammation process. Now, if I smack my wrist with a hammer by mistake and it swells up, that's our inflammatory process, excuse me. That's normal and it's healthy. But the inflammatory process is destructive in nature. It removes dead tissue, it brings swelling and inflammation. When our guts start to leak, we trigger it throughout the whole body. So now what we're doing is we're throwing off our natural body processes. And this is why people with autoimmune conditions have pain everywhere. And they have systemic inflammation, they have high homocysteine levels, they have high C-reactive protein. Their body is now working against itself. Also, when adrenaline gets released from the body, it affects the brain. The hippocampus in the brain controls the anterior pituitary, which controls all hormones. The hippocampus gets destroyed by excess cortisol. It actually causes nerve damage to the hippocampus. So we start to damage the brain. Can you see what's happening? You cannot just take one of these systems out. So when you come to see us, the first thing we do is we run blood tests on you, and we're going to figure out what's wrong. And then we're going to work to correct it. Let me continue here a little bit more. Food allergies. If you eat the wrong foods, your immune system goes insane. And once you start eating these foods, number one, they completely damage your gut, and your immune system starts to attack the lining of your gut. The lining of your gut is important, especially for women. As we convert estrogen, especially women that are estrogen dominant, there's three types of estrogen in the body: 2-hydroxy, 4-hydroxy, and 16-hydroxy. As your body starts to break down estrogen to be removed by the liver, most of that happens in the gut. So when you damage the gut, it tends to move to 16-hydroxy estrogen. That's the highly cancerous form. So you see where I'm going with this? Also, 99% of your neurotransmitters, 99% in your brain, are produced in your intestines. 70% of your immune system is in your gut. When I say gut, I mean large intestine, small intestine, and stomach. So, can you understand what I'm saying? So, my whole point right here was to show you that there is interactions between here. Guys, you can't just take the purple pill. for indigestion. If your digestive system's not working right and you have a food allergy or your gut has been damaged, you must look into it. Everything is connected. So when Dawn came up, you must understand, we did not treat one of her conditions. We treated Dawn. We ran Dawn's blood work. And like I said before, what we found is, in her it was 1, 2, 3, and 4. I'm just picking something. And in you it could be 5, 6, 3, and 2. And the combination is always different. This is why medicine, again, has such a tough time with autoimmunity. Medicine likes silver bullets. GERD, purple pill. Asthma, Ventolin. Cholesterol, statins. But that can't work with an autoimmune condition because an autoimmune condition is a breakdown of multiple systems. But they don't blow out completely. They just break down. They don't work right. That's why this is called foundational healing. We look at all the foundations that you need to function properly. And then I look and I find out, okay, here's the 4 that are off on you. Let's correct them through diet, nutrition, and supplementation. And bring your body back online. And the way we do that right off the bat, it starts with balancing blood sugar, healing the adrenals, cleansing the gut. Those 3 things, once you start doing that right off the bat, and then we give support to other areas that we find that are not working through nutrition and supplementation. There are certain supplements you can do to help the nervous system, the immune system. The immune system is vital, and it's amazing what happens. With nutrition, your immune system makes Th0 cells. They're undifferentiated. They're like baby immune cells. They haven't become a boy or a girl yet. They haven't become suppressor cells or killer cells. When we have an autoimmune condition, our immune system's going crazy. It's making killer cells. Too many killer cells. Using certain vitamins, such as glutathione, something called nitric balance, vitamin D in certain cases, you can actually change what type of cell your immune system makes through nutrition. So imagine taking someone that has autoimmunity, fibromyalgia, thyroid condition, whatever it may be, chronic illness, balancing their blood sugar through diet change, healing their adrenals by balancing out their blood sugar and giving it support, removing food allergies, cleansing and healing the gut, modulating the immune system. How could you possibly be the same human being? You can't. You ever see when people are trying to conceive? They can't, right? His underwear is too tight, I don't know, maybe the temperature's wrong, her hormones are off, she's under stress. It just doesn't work. They can't conceive. But when it lines up right, boom, you can't stop it. Same thing with healing. And this is what people don't understand. Your body is programmed to heal. How come your sister heals? How come your brother heals? How come you're not healing? Because you're not lined up. Once you line up your body and you give it everything it needs, you bring everything back online into a functional level, boom, your body heals. These things look really complicated. They're not. What's those lights, Dave? I'm not going to bore you since my 80s technology is ugly, and I will get through this real fast. But there's 3 stages of autoimmunity. There's a silent stage. The first thing we do is when we run your blood, we're going to find out you have antibodies to self. Your body starts attacking itself. That's the problem. Second phase is you get elevated antibodies with symptoms and loss of function, but no severe tissue destruction. We see that with Hashimoto's disease. We see that with rheumatoid arthritis. You start to get the joint pain. Hashimoto's, you start to get the thyroid malfunction. The third stage is elevated antibodies, significant symptoms, and loss of tissue damage. So we can track this. We know what this is. Don't let this stuff scare you. I just want to show you the top part. Okay. Loss of self-tolerance to autoimmunity. Watch what happens. Pollutants, toxins, hormonal changes, immune-reactive dietary proteins, infections, and stress. Let me bring that to normal. Guys, toxins produce an autoimmune complex. When we have too many toxins, PCBs, pollutants, organic pollutants, they combine with our immune system cells and form a new thing. That new thing is damaging to your immune system. And that helps cause your immune system to go crazy. So we always, when we take on a new patient, we screen them for toxins, heavy metals, things like that. That can be the root cause of your problem. We have to figure that out. And if we find that out, we can cleanse that out. Hormonal changes. if your thyroid hormones are off, if your estrogen levels are off, if your testosterone levels are off, if your DHEA levels are off, melatonin levels are off, that also affects your immune system. It can cause it to malfunction. But you see what we're doing here? I'm looking to figure out why your body's not working right. I am an autoimmune patient. I have psoriasis. My family has that gene. And I watched my brother, who passed away, he was covered like 60% of his body. And he was handicapped, so I know there was a lot of emotional stress. He had CP. But I watched him for years slab on the steroid creams and this and that and this and that. And to no avail. And then when Dr. Weinstein and I started taking this, the first thing the teacher said to us was, if you think that when you have psoriasis, if you think you have a skin condition, you're never going to get better. Because you don't have a skin condition, you have an autoimmune condition. And you better figure out why your immune system's going crazy. If you have rheumatoid arthritis, you do not have a joint condition. You have an immune condition. If you have Hashimoto's, if you have fibromyalgia, you have an immune condition, an inflammatory immune condition that we can correct. Okay, so we're going to check for pollutants, hormonal changes, immune-reactive dietary proteins, is food allergies. If you're eating the wrong foods, and I'm going to show you coming up, it's called molecular mimicry, and this is very common in psoriasis. Staph auregens and strep pyogens are almost identical to keratin in our skin. When your immune system goes crazy in a psoriasis patient, the immune system starts attacking the strep pyogens and the staph aureus, and all of a sudden it gets programmed, gets confused, and starts attacking the keratin in your own body. And that's just for psoriasis. But rheumatoid arthritis and all the other ones, it's the same thing. Your immune system gets confused, and it starts to. And why is it confused? Because your hormone levels are off, your toxins are off, your blood sugar is crazy, your thyroid, excuse me, your adrenal glands are not working right. You're all out of balance. So the whole idea is the concept of having someone like that take Stellara or Humira or Emerald, to me, is insane. You mean to tell me I'm not going to try to improve my body function? I just have to take this little pill that causes lymphoma and yeah, that's it. No, come on, that's crazy. Infections, the Staph aureus, strep pyogen, most of these infections happen in our gut. Dysbiosis is a major cause of autoimmunity. Dysbiosis is bacterial overgrowth in the gut. So if you have a bacterial overgrowth, how do we get one? Antibiotics. In the 80s, I had patients call me back. Because it's like, stop giving your kid antibiotics until it gets cold. What, are you crazy? And then all of a sudden, what happened? Boom, boom, boom. We created all those superbugs and all those drug resistance because we use antibiotics like candy. And what do they also do? And women know that. You go on an antibiotic for a cold, next thing you know, you have a yeast infection, or you have, some type of problem in your reproductive system. Your body is meant to work properly. You can't compartmentize, okay? And the stress response is the adrenal gland. But what happens is, you lose self-tolerance, you start the production of self-tissue antibodies, you start to attack yourself. Not good. Dietary triggers. Intestinal permeability, gluten, and blood spikes. The two most inflammatory and allergic foods right now are wheat and dairy. Guys, every mammal on the planet, the moment it leaves its mother's breast, never touches a drop of milk except the human. And then we don't give it human milk, we give it cow's milk. Not good. Really not good. Now, some people can tolerate it, but if you have an autoimmune condition, you gotta remove wheat and dairy. It's very inflammatory and it triggers the response. Once you get intestinal permeability, undigested proteins break out of your digestive system. Remember, your digestive system's a tube that starts at the top and ends at the bottom. And the only thing that's supposed to get into the body are foods that have been broken down to their core substances. They're broken down to amino acids, fats, and carbohydrates. If a whole protein gets past that stomach lining into the blood, your immune system tags it. And this is why people with leaky gut have tons of it. You watch people with autoimmunity, and all of a sudden they become so sensitive to food and have all these allergic reactions because your gut's not working right. Intestinal permeability and leaky gut is a major problem in this country. Okay. Mechanisms of leaky gut. You have to heal the gut. Socrates said 2,000 years ago, look well to the gut for the cause of disease, and he was right. Now I know this print is real small, so I'm going to just read it. But here's my point. Diet. Alcohol, gluten, dairy, processed foods, excess sugar, fast food. Those are major causes of damaging the gut lining. Corticosteroids, antibiotics, antacid, xenobats. Xenobats are toxins, heavy metals, pesticides. Stress increases cortisol from your adrenal glands and catecholamines, and also adrenal hormones called adrenaline. Hormonal. Thyroid drops, progesterone drops, estradiol or estrogen drops, testosterone drops. We screen everybody to check their hormones, and there's ways to bring them up naturally, so you can help that out. For a female, as you go through the changes, your ovaries stop producing what? Estrogen. Well, God, or the Creator, which I have no problem saying, gave women a parachute. And that parachute's your adrenal glands. That produces a small amount of estrogen to carry you through the changes. But imagine someone who's overweight, eating the wrong foods, has leaky gut, and is massively stressed, has burnt out their adrenal glands. Those are the women that hit the menopause and boom, they fall off a cliff because they burnt out their adrenal glands. So you have to have all these things functioning properly. Okay? Ready? Now watch this. This is pretty cool. This shows what this is a molecular sequence, and this is gliadin, which is the wheat portion of wheat. Excuse me, the protein portion of wheat. This is cerebellar tissue from your brain. E, V, P, L. And that's the only one in that one. See how similar they are on a molecular level? That's why your immune system gets, that's molecular mimicry. Your immune system gets crazy. We find out people that have wheat allergies and leaky gut will have all kinds of coordination problems. All kinds of coordination problems. Then here's the myelin sheath of nerves, and this is strep. FF, WW, GG, AA, EE. Immune system gets confused. So you have a strep infection in your gut, and now all of a sudden you get neuropathy in your legs. Or throughout your body, you have other nerve issues. Okay? That's pretty cool. At least understanding this. Can you tell I love this stuff? Guys, I suffered for years with psoriasis. and even as a chiropractor and being in natural healing, when we started reading this, I was like, I mean, the bells went on. I'm like, my God, this is the first thing that makes sense. I mean, this really makes sense.
Is that how someone gets Guillain-Barré syndrome?
Guillain-Barré can be caused by multiple things. A lot of times it's caused by viral. It was caused by the flu vaccine quite often. But typically it's caused by multiple things. Like that's the point I want to get to today. It's multiple system malfunctions that are probably at the root cause of any condition that you're having. So when you do the functional healing, you're going to check all these things and bring everything back up to functional levels. Real quick, I'm not going to read this whole thing. Dietary considerations for autoimmunity. In addition to internal and external stressors, people with autoimmunity must decrease their physiological stress response by optimizing their diet. The most common and significant biochemical stressor today is dysglycemia, blood sugar swings. And it starts when we have, go to the diner, watch people, stack of pancakes, syrup, or eggs with a stack of home fries and a stack of wheat toast, and we load up on carbohydrates, and now our blood sugar goes super high. And then what happens is, your body dumps in insulin, and it doesn't do it in precise amounts, it just dumps it, boom, boom, and it drops it real low. And the adrenal glands kick in, and that's the person then who has the fatigue and feels tired and eats 3 cups of coffee. And now what happens is, once you mess with your adrenal gland, you start messing with the circadian rhythm between cortisol and melatonin. And cortisol and melatonin are in a circadian rhythm, which means they're in rhythmic patterns. When you wake, cortisol should go high to bring up your blood sugar. And at night it should go down so you can go to sleep. That's why you've heard people take melatonin to help them sleep. But the point is that rhythm, when that gets affected and sleep patterns happen and you can't fall asleep, or when you fall asleep you can't sleep the night, that tells me your adrenal glands are shot. We've got to bring them back online. How do you bring them back on? Diet change. I know not one of your rheumatologists has ever said any of this to you, ever. Or endocrinologist, or specialist. Last but not leastly on this page, I don't like the dance on that picture. How's that, all right? How are we doing on time, Dr. Weinstein?
Good.
Okay. Lifestyle modulations of autoimmunity. Now watch this, I love this one. Adverse mechanisms, excess stress, physically overtraining, lack of sleep, drops in blood glucose, poor social relationships. About that. You gotta be, to have a healthy body, you have to have a healthy life. You have to, physical activity, you need to work out, you need to have loving relationships, you need to have good social bonds. Beneficial mechanisms, love, appreciation, positive attitude, exercise, sleep, stable blood glucose, social and physical interactions. They actually produce opioids with increased TH3 and dampens autoimmunity. And these other ones actually increase interleukin 6 and TH17, which promotes autoimmunity. How about that, huh? It's really important. Really, everything ties together. But I think what I want you to get from this is you can control that very easily. Think of how, again, most people with autoimmune conditions, you feel powerless. No, there's a lot you can do yourself too. Very important that you understand that. Okay. This is pretty cool too. An imbalance between anti-inflammatory effects exerted by cortisol from your adrenal glands and the pro-inflammatory effects exerted by melatonin, remember that's the cortisol-melatonin cycle, during the night seems to be evident in the clinical symptoms noted with rheumatoid arthritis. And what they're finding out is anybody with an autoimmune condition, I'm using rheumatoid arthritis as an example, that melatonin and cortisol system is out of whack, almost in every case. Leaky gut, adrenals. You fix those two, man, I'm telling you, you're going to see a different human being. And if you look up here, clinical symptoms in rheumatoid arthritis happen mostly in 1 a.m. and 5 a.m. and 9 a.m., and that's because the whole system's backwards. We got a few more guys. Just want to make sure you understand. A study at the Mayo Clinic found the observed prevalence of multiple sclerosis at onset of inflammatory bowel disease was 3.7 times the expected. We have linked, once you get leaky gut, once your gut starts to leak, I want you to imagine a cylinder of water and drop in iodine. That's those inflammatory cytokines that get released. When those inflammatory cytokines get released, the first thing they do is cause mitochondria in your cells to slow down. Mitochondria in your cells are the power plants. This is why people get massive systemic fatigue. Their gut's leaking. Right after that. Second thing it does is it causes depression. So when you tell me that you have all kinds of brain fog and can't remember when you walked in the room and you're forgetful and you're going through bouts of depression, it's all linked to inflammation. Major causes the gut. Guys, everything is the gut. I can't stress that. Blood sugar gut, you gotta heal it upright. And we've destroyed them in this country with antibiotics and our diets after World War II. Destroyed them. Coca-Cola is like liquid cancer. It's brutal, brutal. So inflammatory bowel disease, meaning that your gut's damaged, it's leaking, it's triggering that crazy immune response, starts with, it's linked to MS. So every person, every woman that comes in that has depression or brain fog and female problems, we check their gut. It's always a mess. It has to be. Fix the gut, they get better. Pretty cool, huh? Decreased activity of the brain. 99% of your neurotransmitters are produced in your gut. Gut damage is brutal. But what happens here is, it's really simple, that when your brain function slows down, you get decreased intestinal blood flow, you get intestinal permeability, you get cytokine activation, and it causes your brain to malfunction. The brain and the gut are so linked together that you can't go one and one. You can't, this is why it's so crazy when we hear people just saying, I'm taking Paxil, I'm taking all these antidepressants, and they're not looking at their gut, or vice versa. I've got IBS, I've got Crohn's, I've got ulcerative colitis, and they're not looking at brain function too. You have to look at both of them. They go hand in hand. Suppressed intestinal immune activation also causes it. And what happens is that the decreased intestinal mobility or motility increases yeast overgrowth and bacterial overgrowth. So your brain function, when your brain function slows down, it actually damages your gut. Pretty cool, huh? David, I think I have one more. No, I'm not gonna use that one. Okay. Now, we're chiropractors. Our job is the restoration of function. When patients come in to see us, we have a two-pronged approach. I just went through our metabolic approach. We run your blood, we're going to figure out what's going on with you. We're going to look at your diet, we give you a food journal. We write down everything you eat. We're going to look at you, examine your food. We're also going to examine you structurally. What controls everything in your body? Brain, spinal cord. There's a structural component to making you work well. Now everyone knows chiropractors are always for back pain, they're good for this, they're good for, structural back pain stuff. That's what most people understand chiropractic, and we are very good at that. But there is something called upper cervical chiropractic that works on the top two bones. And I take care of AIDS patients and cancer patients, they don't have back pain. They come to me because when you misalign the upper part of your neck, you can actually cause multiple and severe body malfunction. Again, what was my goal? Restore your function so you heal. So this is the effects of upper cervical adjustments on the CD4 counts of HIV positive patients. Pardon my copy, it's old. Your immune system makes CD4 and CD8. That's the two sides, suppressor and killer types, okay? In HIV patients, what happens is they lose the CD4 and then they end up dying. They don't die, no one dies from AIDS, they die from the cancers that come about or viruses or pneumonia because their immune system's dying. So what happens is it attacks, the AIDS virus attacks the CD4 part of your immune system. So they did this test where they took a bunch of people and one half of the group got an upper cervical chiropractic adjustment and the other half got a fake one where they didn't do it. I don't know how they actually, they called it a sham adjustment, so they made a clicking noise or something with it. The person didn't know. So that was the control group. Chiropractic care in HIV patients. The group that got the adjustments had a 48% increase in their CD4, where the control group got 8% less. And I have the official written one out here. Okay. I'll just read you the abstract real quick. The research of this project sought to demonstrate that upper cervical specific adjustments would have a profound effect on physiology, serology, and immunology of HIV positive individuals. The effects of the specific upper cervical adjustments on the immune system's CD4 cell counts of HIV positive patients was measured. The test results performed by the patient's independent medical center were then under medical supervision for this condition. The measured CD4 counts in a regular group were dramatically increased over the controls of the control group. A 48% increase in CD4 cells was demonstrated over a 6-month duration for the adjusted group. David, turn the lights back on. So, our approach is pretty cool. We do the metabolic testing, we take an x-ray of your upper cervical spine. That upper cervical spine, even though I'm only spending 3 minutes talking about this, it's pretty simple. The metabolic is complicated, that's why I spent a lot of time, so I wanted you to understand that. But with the structural part of what we do, that upper cervical is vital. I mean, what is your big problem if you have an autoimmune? You have an immune malfunction. Upper cervical chiropractic care is vital in that. Restoration of normal function so you heal. So how cool is that? We have a structural component, we have a metabolic component. When we figure out what's wrong, we correct it by correcting the upper cervical and changing your diet based on your blood to bring everything back up to normal. And you heard Dawn, who came in and said, it's only been most of our programs are 6 months for the average adult, some longer, some less. But Dawn was only there for 3 months. Look at the changes that she had. Doc, and is Tracy here? Okay. I have another special guest I want to hear. Tracy was one of our patients, and she's going to just speak for a few minutes again to show you guys what we do. I'm pretty much done. I hope you enjoyed it. It's not complicated. It just takes effort. And there's no easy way to fix autoimmunity. You have to get healthy. And I always tell my patients, if you do the work, you're guaranteed to get better. Most of the patients don't do the work. They don't want to make, oh, you mean to tell me I can't have my Italian bread? No, you can't. I don't know, you want to take alcohol? But it's really, oh, I mean, I can't drink martinis every day? No, you can't. I'm sorry. I know, I love martinis. That's a tough one. I understand that. But if you do what's necessary and it's not crazy complicated, you'll get better. I hope you like it. Trey, come on up. Thanks, guys. I appreciate it.
Folks, over to you. This is one dramatic experience, so I'd like to share.
Okay. I am going to speak fast, not because you have a half an hour attention span, but because I don't like this. I'm very nervous. My name is Tracy, and on Tuesday I will be 56 years young. Thank you. Several years ago, I suffered from IBS for years, and I do have a primary care. I love my primary care. He's been my doctor for 19 years. But these doctors are not trained to cure. They're trained to write the pharmaceutical for whatever your symptoms are. They're not healing anything. So I suffered from IBS for years, take more pills, chronic fatigue, take another pill, insomnia, take another pill. I finally went to a gastroenterologist who ran thyroid panel and found out that I had Hashimoto's. I went back to my primary care. You've been taking this test every year. Why didn't you find this? He wasn't taking the right test. These guys take the right tests. My thyroid, I was told I had a 2 centimeter tumor on my thyroid. My cancers go for biopsy. I went for biopsies every 6 months. Weakness started in my legs, the pain started, turned out to be fibromyalgia. I went to the rheumatologist, take Cymbalta, take Lyrica, take Savella, all of these horrendous drugs, prednisone. I gained 28 pounds, couldn't lose the weight. I got weaker, I got sicker, my muscles just wouldn't work. I was pretty much bedridden, couldn't work. I was in and out of the hospital because your diaphragm is a muscle and it's not working, I can't breathe. And I started to plan my funeral for my family. As Dr. Weinstein said, I stumbled across them and I went chiropractors. I've been to Stony Brook, I've been to Manhattan, and they all said, stop looking for a cure, just deal with your symptoms. I wasn't happy with that. These gentlemen said, give us 6 months and we'll give you your life back. I had nothing to lose because I was ready to give up. So they put me on what they call a diet. I'm not happy with that word. I don't like diet. It's a lifestyle change. Your body likes certain foods. It doesn't like certain foods. The cure for what ails you is not in a pill. It's on your fork. I will never drink another soda again. It tastes horrible to me. Dairy, I drink almond milk. I could never drink milk now. Your body doesn't like it. And once you start giving your body the things it likes, you start to heal all of these different things that are going on. Now, I've been getting the biopsy on this tumor every 6 months, and I am now I've been a patient for a little over 2 years, and my tumor has shrunk naturally 55%, just by doing what these doctors have advised me to do with their supplements. And again, the blood work they take is amazing. Hormones, hot flashes, ladies, oh, yeah. Talk to these guys. Okay? So I guess is that...
Just share with them what happened when you went to your doctor and tell me you were
That's great.
Oh, yeah. When I first went to this new, the guy who was doing the biopsies, I told him what I was doing. I had these wonderful guys and didn't want to hear it, didn't want to know it, nah. And as it started to shrink, I went back and he did this sonogram or ultrasound, whatever they do, and he said, I'm looking at somebody else's records. There's something wrong here. There's something terribly wrong. He leaves the office, he comes back and he said, these are your records. And the tumor has shrunk by 55%. What are you doing? I said, now you want to hear what I'm doing? Now he wanted their names, their phone numbers, so that he could conference with them to find out what their miracle cure is.
We didn't call him.
Okay, so here I am. I lost the 28 pounds that the prednisone put on. I feel great. I think I look great. So that's it.
She's shy.
This is the answer. This is the answer. Love you. Love these guys.
So, one of the things that they didn't mention was that when you become a patient in our office, as Doc said, we do an initial assessment based on some paperwork, based on your previous blood work and what kind of conditions you have, and then we send you out for all this sophisticated lab work that we do. We take x-rays of your neck. The first thing we do is change how you're eating. We get you on the supplement package. We're adjusting your spine. In 3 months, we retake the blood. I think one of the things neither one mentioned was that after 3 months, their blood tests were dramatically better. Not slightly better, but dramatically better. And this is consistent with the patients. We're not treating your condition. We're treating the findings that we get through the blood work and the x-ray, and then we make them better. Lo and behold, when they're better, you're better. So I don't know if this resonates well with you folks. Is this what you're kind of looking for? I mean, natural healing's been around for quite a long while. I mean, you have Bernie Siegel, Deepak Chopra, Gary Knoll, Dr. Schultz in California. I mean, there's schools now for this type of thing. We've been doing it for a long time, so we're kind of probably ahead of the curve. But this may all sound, foreign to you guys, but it shouldn't be, because this is where healthcare is going. And, where we believe that patients should be looking to get the answers to their health problems. So when a patient comes to our office, if this is something you would like to do, the first thing we do is a consultation. And we don't even charge for a consultation, because we need to make sure that you have a problem that we can help you with, and after telling you what we do, that you feel that we're the right office for you. Hopefully you got a sense of what we talked about today, whether this is what you're looking for. The next thing we have to do is x-ray and blood work. We normally charge $350 for that. We give you these assessment forms, you fill them out, we get like a practical sense of what's troubling you, because sometimes blood work is negative. You ever have a doctor say, we're not seeing anything, but yet you're still suffering, particularly with thyroid problems? Well, we can tell with our assessments where you're having problems by asking questions on all these systems, running blood work on all these systems, and compiling it all together to come up with a plan for you. Again, we normally charge $350 for that. So what we would do for today is for anyone who would like to come in and get examined, we would lower that fee by half, so it would be $175. If you want to come to the office, you can make an appointment with the girls in the back. We set aside appointment times over the next couple of weeks so we can really accommodate probably everyone in the room, or at least most of you if you'd like. You come in, we do the consultation, it would be $175. We run the tests on all your systems, we take x-rays of your neck, and we have you come back for a report where we can sit down and not point in circles anymore. Show you where your problems are, tell you how long it's going to take, where we need to go. The girls at that point will look at your insurance, figure out what it will or won't cover, so we can answer those kind of questions, and we just go forward from there. Okay? So if you like what you heard, Dorothy and Martha and Denise are in the back. You can leave your email address at the desk, and we'll put you on our email list. We're always sending out stuff. So we're going to try and even make a blog, so maybe we can start putting health tips every week on our blog. You guys can follow us that way. But I really think that if you're looking for answers, you just have to look a little deeper. And we always tell patients, we kind of feel like we're detectives. And we're getting all these pieces of puzzles from the blood work you previously had, the drugs you're on, the symptoms you're having. Sometimes the symptoms are from half the side effects. And one thing Tracy didn't tell you is how she came off nearly every medication she was on.
14.
Yeah, I mean, there it is. So, now I think, especially if you want to new patients, we see they're putting you guys on methotrexate. These are all, it's like chemotherapy. They're trying to just shut down your immune system. Yes, it gets you relief, but what's it doing to your health? There's a better way. So guys, I hope you learned a lot today. I don't know what else we can discuss, but you've been a great audience. I really appreciate you coming out there.
Thank you for coming, guys.